Hello, good afternoon. Can you hear me?
Yes, no.
All right. Unless some of you are in YouTube, some people they have seen 100 for the Zoom, which is the limit. So some are to join via Zoom. So I believe some have joined there. No. So can we go on? Yes, come on.
No, please, no.
We should wait more.
Yes, I don't know, but it looks as if it looks as if yes, it looks as if this page can only accommodate 100 people, and we are more than like 350.
So they are supposed to join the YouTube link.
The YouTube link.
Yeah, okay. It's live on YouTube. So can you put it on the page? I think Ohinijan put it on the Claret pages. Yeah, so the YouTube link is there. Can those who cannot join, please join through the YouTube. It's a long time. I said, come in. My voice is not Hello. So I think we can start now. Yeah. So I'll check if you have any comment. If you can't hear, you can raise your hand. Those on the Zoom, you can raise your hand and then let us and send your message, or I'll let you talk. And those on the YouTube, you can also send comments. You can ask questions through there, then I'll respond to you. Yeah. So we are looking at the nervous system or the neuroanatomy. We do neuroanatomy. We also look at the next topic. We will be looking at the reproductive system, that's the female reproductive system. And then we'll also do the special senses with me. Then the other courses topic, as we already started doing it with Dr. Ohinijan. So we'll just, I believe you've already done neuroanatomy. So we'll just walk through it. And if there are questions, like I said, you can send them to me. Yeah. So this is, nervous system is one of the systems that all right, so let's continue. Now the nervous system is very important system in nerves and also very important system in clinical practice. Very important in clinical practice. And then there are a lot of disease conditions that usually affect us or affect people that they need treatment. Okay, so based on that, we'll need to just run through it. And when you are doing your internal medicine and others, it will also be of use, like the nervous system conditions. It will also be very important for those purposes. Like you heard of stroke, or some of you are managing cases regarding stroke, and then the paralysis and others. So they are a very important system that we have to look at. The nervous system enables us to do everything that we are doing. If you are walking, you are singing, you are dancing, whatever activity you undertake, it is the nervous system that enables us to do that. So it's really a very important. Without the nervous system, you will not be aware of where you are. Your brain is the one that controls everything, and therefore, and even other systems in the body, like the endocrine system, and these help us to learn what it is. Yeah. Okay, so these are the objectives. We want to look at the organization of the nervous system. We also look at the function of the nervous system. And then we describe the histology, that is the cells that form the nervous system. Okay, is it Gabriela Mukaila? Your hand is up.
Yes, Doc.
Yes.
Doc, please, the YouTube page. They are complaining that they can't hear.
They can't hear. Wow.
No, see anything.
Oh, but I can hear.
Is their devices because I am following on YouTube.
Yes, I think I can hear. Just put on my YouTube volume, and I could hear myself there. So I don't know. Mukaila, so maybe let them check what they are having.
Okay, Doc. Okay, Doc.
So let's go on. And also it delays in the YouTube. I think it delays more before they get it. Yeah. So we will be looking at those things. We also look at the covering of the brain. So after we look at those components and the histology, we look at the coverings of the brain. Then we look at the various divisions of the brain. We take each of them, the nervous system, like the central nervous system, which is made out of the brain and spinal cord, and also the peripheral nervous system, made out of the spinal nerves, cranial nerves, and then we'll talk about the autonomic nervous system and other enteric nervous system. Now, these are the three main components or functional components of the nervous system. Like functionally, the brain, the nervous system in general control our behavior. The way we walk, the way we talk, the way we do our things is the nervous system that enables us to do that. The nervous system also help in the processing and retaining information, like what we are learning is supposed to be retained in your brain. Okay, it's supposed to be retained so that if we come back and they ask you what the function of nervous system, you should be able to bring it back. So you see that processing and retaining, and then be able to recall. It's all the brain that will do that. And then the regulating the body's physiology. Okay, so also regulating the body's physiological processes. And these, like how the temperature regulation, if your environment is hot, the body will have to undertake processes to bring about decrease in the temperature in your body. So that maintaining, we call it homeostasis, is maintained. And these are influenced by the nervous system in that. So this is the general organization of the nervous system. So if you look at, you take this one as the brain and the spinal cord, usually we call it the central nervous system. And that one is for integrating and interpreting. So let's take it. We're saying that the nervous system is made up of three main components. Three main components. If you have a pen, you write it down. So they have three main components. And the first, we are talking about this one, that is the central nervous system, which is made out of the brain and that of the spinal cord. And they are involved in integrating and interpretation of information. Then this part is called a sensory component. This one, that is the sensory component. And this helps in the sending information from our environment, either internal or external environment, they send the information to the central nervous system. So we call that the afferent component. So the fibers. Now, the nervous system, this part, there is part of the peripheral nervous system. Okay, we have the two main ones. I'll go to details to that. We have the two main parts, so the central nervous system and the peripheral nervous system. Then the central nervous system is for the integration and interpretation of the information. But the peripheral nervous system, we have a component that sends information from the environment, like the external environment or internal environment within the body. They send that information to the central nervous system. So this portion we call the sensory component, and the fiber that send information to the central nervous are called the afferent fibers. Okay. Then from the brain, when the brain interprets the information, it now sends another information to what we call effector organs, like organs that will respond to the information, that will respond to what you have integrated and interpreted from the brain. Okay, so that is how it is. So let's look at it here. We're saying we have the sensory input. The sensory input, like I'm talking, you are hearing what I'm saying. It's a sensory input. If somebody touches you, or maybe you step on a nail, or you touch a the hot plate, these are all sensory input. And from there, the fiber carries, that is the nerve, they carry that information. Let's say it's heat, then it carries through this. So this fiber is called afferent fiber. Okay, that the afferent limb. Then it brings it to what? The central nervous system. That is the interpretation part. That will interpret. Let's say you mistakenly touch hot plate. So the heat moves through this one, the afferent fiber, to the brain, and the brain interprets the information and then send it back to the muscle in the hand that touches the hot plate. And the muscle will contract so that you take out the hand. Okay, so the fiber that is bringing this information to the muscle is the efferent fiber. So that's the efferent component of it. Okay, so if we have this, so let's look at this one. They say you should select those ones, like you should mark them. You mark the best with A with the B. Okay, so if you look at seeing bottle of water, is it sensory? Is it the integrating component or interpretation, or it is the motor component? That is what it means. So, okay, so anybody, you can just pick one and you match it so that you can hear. Seeing bottle of water, which component would that be? Is it sensory? Is it a sensory input, or is motor, or is integrated? Yeah, D. Is it the, yes. You can talk. Hello, who's raised your hand? Just unmute yourself and then you can talk. Oh, we can't hear you actually. Okay, so we also have touch from a classmate. We also have we are picking up the cup, thinking. You remove your finger from hot plate, memorizing. So you get to determine which of these activities belong to
remove
the
finger from hot plate is sensory.
It's sensory. Good. So you are saying remove finger from hot plate. Will it be like is it really sensory? The movement, that means information has gotten from the brain to the muscle, and then you remove. So would that be sensory, motor, or integrated? Yes, Segadi. Your hand is up.
Yes, sir. Sir, removing finger from hot plate is motor. It's motor.
It's motor, yes. So that is motor. Good. Anybody else that can pick another one? Those in the Zoom, if you have any question to ask. Okay, those in the YouTube. Yeah, somebody was talking. Okay, so Dora is saying he is good. Yes, we agree to that. Somebody, David, is saying A is integration. So A is a seeing bottle. The seeing bottle. Is it integration actually? And somebody say C is I. You pick up of water, like picking it up. Is it a C, a I rather sensory? I don't really think so. David. Yep. So let's see. Let's go ahead. This is what we have. Good. So the color indicates which is which. We have C bottle of water because it's sensory. You see the thing, and there's sensory input of that. By a touch, also a touch that the touch that you somebody touches you, it's a sensory input. That is sensory input. Then pick up the card like it's motor. Okay, it's a motor activity, movement. But remove finger from hot plate. Yeah, somebody answered this one rightly. And then memorizing and thinking, integrating. Yes, Edward, is him. The CMO.
Sir, please. Yeah. Sir, please, can you go over small?
Okay. So
the central and the nervous system.
Okay. But I'm saying that the nervous system has three main components. Okay. So we have the sensory input component, that is sensory part, whether external environment or internal environment, information is sent to the brain from, let's say, hot, or let's say temperature, either something is cold or hot. When you touch it, it goes. Or you step on something, it's a touch, it goes to the brain. So that is the sensory input. Like this one, we're saying somebody touches you, you feel the touch. How do you feel it? That means there's some sensory input that is carried to the brain. Then we also talk about the central nervous system, which is what? The one that integrates and interprets the information that has been inputted, like the computer system. The nervous system is like the computer system. If they are the input devices. Then we have the central processing unit that will interpret whatever key you type. If you type A, the A will appear on the screen. The screen is the output device. And in terms of the nervous system, these output devices are the nervous, the motor component or the efferent component of the nervous system. So that is what we are saying. So you can at least compare that. You can compare those ones. So this is what we were talking of. So see the bottle here, okay? And the moment you see this, it goes through that is sensory input, and this fiber is called afferent fiber. It comes to the brain. Then the brain interprets it. See, wow, this is nice bottle of Coke, and I'm hungry, I don't have money, so the brain is trying to see whether it should steal it. It should steal the Coke is not yours. So you are interpreting whether to steal the Coke, nobody is looking there, you just pick it and put it in your pocket. Okay? You see, the brain has decided that, or let me buy it, or if you don't have money, what do? You can beg. So you are interpreting. You see the Coke, you are hungry, and you are interpreting. Now, if you interpret that and it comes that, okay, let me take it. Or if you have the money, you buy it. Information from the brain will now move through another that we call the motor output. That is the efferent fibers. Then it comes to the muscle. And these are called effector organs. Then you pick it, can be cooked. So that is how the whole nervous system is. So those are the things. Can you mute yourself so that we can hear? Okay. So this is how.
Patricia Deborah, you're making noise.
Thank you. Okay, so this is, so I'm going to write here NS, so N, and then S is not, okay. So NS, that is nervous system, is divided into two main components. So please, if you have not even learned anything today, this afternoon, please just know that you've learned two things. That the nervous system is made out of two components. That is central nervous system and then peripheral nervous system here. And after that, the central nervous system. So please, can you be writing? Can you be writing for me? So get write NS in your book. Those of you who are working while listening on your phone, can you just stand somewhere and write down? Then you start moving again. So you get right, NS equal to A is divided into what? Central nervous system and peripheral nervous system that we have. And the central nervous system is made out of the brain. And then the brain is in the head. That's the one you are carrying inside the head. And then you have the spinal cord, which is in the vertebral column. Then the peripheral nervous system is made out of the input component and the output component. That is the sensory, is the input. Okay. Now sensory can be it can be visceral. When you say visceral, that means the internal one. So this information comes from the intestine, your heart, your liver. So those are the visceral we are talking of. Let's say you are hungry, your stomach, and the hunger will move to the brain to tell the brain that you are hungry. The whole day you've not eaten. You see that? Then somatics, the somatic sensory division is the one that let's say we're talking about somebody touches you or you step on fire, or you can do practical. You can even go and touch a hot iron, then you feel that. Then we have what? The motor component. These will come to the center for interpretation. Then when they interpret, let's say you put your finger on hot iron, so the brain will say you are on hot iron, are you a fool? Then ask you to remove your hand. That one is the motor component, the movement in that. Or so they pass through the afferent fiber to do that. And the motor component can also go to the viscera, that is the internal organs, or it can go to what? The body, like the upper limb, lower limb, and then the body, the trunk, the outer part of the body. You see that? So when the outer part, we call it somatic motor, and when the visceral, the intestinal, we call it the visceral motor, or we call it autonomic nervous system. Actually, yes, Edward is him.
Please, can you repeat the visceral sensory for me?
Visceral sensory. So I'm saying that the visceral sensory is when sensory input are coming from the internal organs. Example, hunger. Hunger is coming from your stomach, or you are thirsty. You get that? Those are internal sensory input, and they will go to the brain for you to interpret. But the somatic are those, let's say, outer part. They are not internal organs, but the outer part of the body, like the upper limb, your hands, your legs. You step on something touches you, and those ones. Those are the somatic sensory. So when it comes to the motor division, it's also the same thing. We have the visceral. So I will now say that the visceral, we usually refer to it as the autonomic nervous system. I believe you heard of. So let me write it here. So we have the autonomic nervous system here, like this. So that's autonomic nervous system. So the autonomic nervous system is the same as this one. So here, and it's made up of sympathetic and parasympathetic. That means information can go to your heart and speed up your heart rate. That is sympathetic division. It can go to the heart and decrease the heart rate, and that's parasympathetic division. Or it can go and speed up the movement of the stomach. That is parasympathetic. Okay. The same can go and then decrease the movement of your stomach. That is sympathetic. So the same organ can have sympathetic and parasympathetic. The autonomic system. The sympathetic deal with the flight or fight. The flight or fight activity. Okay. So who say flight or fight? Yeah, imagine where you are sitting. Those of you sitting under the tree, a snake has just fallen there in front of you. Just imagine what happens. You either fight the snake or you run away. Okay, so immediately you get some energy that will enable you to breathe more. So there is the increased respiration, and then there's also increased heartbeat. Your heart starts pumping fast. So the blood will move to the muzzle so that you can either fight the snake that has fallen on you or you run away. That is what we are talking about. And during that time, the parasympathetic activity will also affect the stomach and other, because when you are in danger, that is not the time to sit down under a tree and be eating. Imagine there's a snake, they help you eat. So when parasympathetic is acting, there might be antagonist action by the sympathetic in a way. Okay, so those are some of the division that we have in that. So this is showing us in pictures. This is cerebrum. That we have the brain, and then we have the spinal cord. Then you can see the yellow thing there. These are the nerves. Okay, these are the nerves. That the nerves are like electrical wires is just perfectly like electrical wires or electrical cable. So anytime they are connecting from the central nervous system, either the information is carried toward them, toward the central nervous system, we call the sensory input, or the afferent fibers, or they are from the brain and coming out. Okay, now and coming to the periphery. So anytime, because they are like electrical cable, when there is a cut, anywhere, then it means there will be a cutoff of the impulse that's supposed to go to that place or from that place to the central nervous system. Or if we have a road and then there's a bridge there and the bridge is removed, you can't move from one point to the other. That is what it means. So they are like electrical cables. And when any of these cable is broken, the part that the light is supplying to will be in darkness. They will be doing so at the area. That is what it means. Okay, so then the peripheral nervous system meter of the motor and sensory, and then autonomic nervous system, which is made out of sympathetic and parasympathetic. Okay, so now we want to look at the nervous tissue. What are the things, the components or the substances that make up the nervous system? There are two types of cells that make up the nervous system. So this one, you should write it down. There are two types of cells, two main types of cells that make up the nervous system. Okay, two types. Are you writing? Now, one, we have what we call the neuron. So let's write the neuron there. And then two, we have the neuroglia or glia cell, okay, or supporting cell. It's the same thing. We'll look at it in detail. Now, so this one I'm just talking about the same thing. So if we take the neuron, okay, so they are written here. So this is the neuron or nerve cell. Then we also have the neuroglia or glia cell. These are the two main, I would say that are written here, two main cell types that are found there. So what is the neuron? The neuron is the basic functional and structural unit of the nervous system. The basic functional and structural unit of the nervous system. And that is the one that carry out all activity we are talking about. They are like the cables. They are like the wires, the copper wire that we have. Okay, so the basic functional and structural unit of the nervous system is the one, neuron. After this, we'll write online Google form. So those will be some of the things we can just. What is the functional, the basic structural and functional unit of the nervous system? So write down the answer first, because I will ask you that question. It will definitely come. We'll write a Zoom, Google form, or you Google form for online IE, maybe within the week, either tomorrow. It shouldn't be far, so that you revise and then we'll do that. Then it receives, the neuron is the one that receives stimuli and transmits action potential. When they are that new impulse, it consists of two main parts. Okay, so let me try to sketch this one. So we have what we call cell body, and the cell body contains the nucleus, okay, and then other cellular organelles. That's what we call the cell body. Then the cell body from the cell body, there are what we call processes. Okay, so the processes are extensions from the cell body. So we have some like this, which are shorter. Then we have one that is long. Okay, so the one that is short, this short one, or it can also be long. This one, they will conduct impulses toward the cell body. So we call them dendrites. So this is dendrites. They conduct impulses toward cell body. Then this one conduct impulses away from the cell body, and this is called axon. So this is the axon, okay. And then so axon here, dendrite. We have the cell body. We have talked about that. Okay. So the neuron is a basic functional and structural unit, okay, of the nervous system, and is made up of cell body and processes. And we have two types of processes. That is those that conduct impulses toward the cell body, and those that conduct impulses away from the cell body. So we could ask questions like, which structure conducts impulses away from the cell body of a neuron? And that is axon. So that's another question that you should write down because it will come in the exam. Okay. So to come in the exam. I want to see some people. Okay. Then this one, they conduct impulses toward the cell body. So we could also say which structures conduct impulses toward the cell body. So another question like that. Okay. Then we have this one. We call the second type of cell, that is the neuroglia. This. Okay, neuroglia. Neuroglia are supporting cells. Okay, they are supporting cells to the neuron. And we have about 6 types of neuroglia. 6 types of neuroglia that are there. Okay, so this is just showing the picture of the neuron. So the cell body. You should also homework. You should draw the neuron. When you come out, I will collect them. Okay. When you report, I will collect them. So you should draw the neuron and label it. So I'll write it in my diary that I've given you homework. Draw the neuron and label. Okay. Draw the neuron and label. Those on the YouTube, I hope they are hearing me now. You should draw the neuron and label. So that is one of your question 1 for the homework. So they are all here. These are type of neuron. Yeah. Then we try explaining them here. Okay. These are now another thing. Let's say a neuron traveling from your finger all the way to the brain. You may not have one neuron traveling like that. So you have a neuron, let's say this particular neuron is traveling all the way here. Then you see that it ends here with what we call terminal battles. Then there will be another cell body like this, and they will have dendrites toward there. Then this is the axon that will continue up to the brain. Okay, so you may have a neuron travel to a point, then connect to another neuron, then connect to another neuron. So the connection, there is usually a gap, and these are called synaptic gap. Okay, where one neuron connect to the other. Now that gap, before the impulse will travel from the first neuron here to this one, then they have to release what we call neurotransmitters. Is here, this one. Okay, so neurotransmitters. And we have several types of neurotransmitters. For example, we have dopamine, acetylcholine, adrenaline, or epinephrine, is the same thing. And these neurotransmitters will now come and bind to the dendrites of the second neuron. We call it the postsynaptic neuron because this is what we call synapse. So postsynaptic neuron. Then the impulses are now travel through the dendrite. Remember the function of dendrite. They conduct impulses toward the cell body. So the impulses come here, and then it continues through the axon again. That is what we are talking about. So that is the synaptic cleft in that.
Sir.
Yes.
Sir, please go over again.
Wow. Let's go over. Okay, thank you. I'll go over. Now, so we're saying that impulsive traveling. Let's use an example from your finger. You touch iron just to practice that how impulses travel to the brain. You just touch iron, and then impulses from the finger will travel all the way. But because it's long, it's not one neuron that will travel to the brain. So it will get to a point where another neuron will join to it. But because it's not like a copper wire that you get tie them and they will tie together, there will be a gap between these two neurons. And that gap is called synaptic cleft. Okay, synaptic cleft. Now, within the synaptic cleft, the neuron before is called presynaptic neuron. And the neuron after that one is called postsynaptic neuron. So the presynaptic neuron usually release a neurotransmitter. Example of neurotransmitters include, we mentioned acetylcholine, dopamine. You can Google this one and get it. Dopamine, adrenaline, and
Papa.
Hey.
Can you mute yourself?
Sorry.
The baby is crying. Okay. So the dendrites will carry that information to the postsynaptic neuron, and then the information continues. That is what we're saying. Okay. So if we read this one, so this is what we're talking about: presynaptic neuron, synaptic cleft, or we've talked about that. Newman, Duku, your hand is up.
Yes, sir. Please, if I want to understand what you are just saying, I just want to make a scenario. If that is,
you want to understand what is what?
Like the way you are saying there are snaps or whatever. When you said when the message wants to go to the brain, let's say from the finger to the brain, it's not only one neuron that carries that activity. So I'm just trying to say that, let's say you want somebody, let's take the auditorium.
Your voice is very low. Can you speak up a bit?
I'm saying that I want to get an understanding of how the neurons work. You said it's not only one neuron that takes message, let's say from the finger to the brain. And I'm saying that, for instance, you want to give a pen to somebody at the last end of the, let's say, the class or auditorium. So let's say you give it to somebody on the first seat. The person also give it to somebody behind you until it gets to whoever you want to send it to. So I just want to know if that is how it works, so that I'll get my understanding well.
Okay, so you were using an example like you come again. Your line was my line was unstable.
I was saying that you said it's not only one neuron
that
the finger to the brain. It's not only one. So when I'm using that scenario, that means that it's just maybe I want to give a pen to somebody, let's say on the third or fifth row. So I pass it to somebody by my right side. The person also receive it and give it to another person, and that person send it in that order to it.
Okay.
Whatever destination I want to.
Exactly. That is how it is. That is how it is. Yeah. Okay. So you start with you give it to the next person, the next person give it to another person. Yeah, that is how they do it. But how do you give it? How will the information be given to the next person? So in the term of the neuron, they use neurotransmitters. And the example of the neurotransmitters are those we mentioned. The acetylcholine, the dopamine, we have GABA, we have glutamine, those sort of things. And they are all, some are neurotransmitters. Okay. So neuron, we're still talking about the basic functional. Now we have 3 types of neurons. We classify them based on its structure. Now, let me get you a simple one. So if we have a cell body like this, now if this cell body, we have one process coming out from it, one extension, we say the process is an extension from the cell body. So we have one process coming out, then we call this one a unipolar neuron. But if we have this is cell body, and on this we have one process here. Okay, we have one process, another one here. So there are 2 processes coming out from the cell body. Then we call this one a bipolar neuron, because they have 2 processes coming from that. Then if we have this, and maybe you have this is my axon, and you have added this one, then we call this one multipolar neuron. The multipolar neurons are the most abundant neurons in the central nervous system. The bipolar neurons are mostly found in places like the retina, okay, places like the ear, those places. But the unipolar neurons are the sensory neurons that carry information, like somatic sensory neurons are unipolar neurons. That is where you can find them. Okay, so somatic sensory neurons. So this is how they look. So this is multi, this is bipolar, and this is unipolar. You can see that. Okay, it's the same thing that is here. And like we said earlier, we can also classify the neurons as afferent or sensory. Afferent means you carry the information from the periphery to the brain. That is afferent. And then those that carry the information or impulses from the brain to the peripheral organs are called the efferent or the motor. Then we have those in the central nervous system that link, that connect them. We call them interneuron, or we call them association fibers. So they are tied. Hey, somebody here to come again. And so I was saying that the bipolar, unipolar, and then multipolar. Multipolar, when on the cell body, like we have several processes coming out. In the bipolar, only 2 processes come out. In the unipolar, you just have the cell body with one extension. That is what we call a unipolar neuron. Okay, so these are interneurons, or those that are found in there. Then we'll go to the second type that we call the neuroglia, the second type of cell. Let me go back small. We said we have 2 types of neuron in the nervous system. 2 types of cells, 2 main types of cells in the nervous system. And these include neurons and neuroglia. Neuron and neuroglia. So we talk about the neuron, and we say the neuron is the one that contains is the basic functional and structural unit of the nervous system. And it's made up of cell body and processes. And the processes are 2 types. We have what we call dendrites that carry impulses toward the cell body, and axon carry impulses away from the cell body. Okay, so those are the basic functional. Now, when a neuron is matured, you can, and then it's injured, it cannot be repaired. Okay, it cannot be repaired, or it can't regenerate. Mature neuron cannot regenerate. So that is what we talked about. Then now we have the second type of cells that you find. Those of you who chop the brain. That means when you are chewing the brain, or do you chew or you swallow? Okay, whichever. If you are eating the brain, the type of cell you are eating are two types. You are eating the neurons and then the neuroglia. That is what it means. We have 6 types of neuroglia. The neuroglia are more, or we call them glia cells. They are the numerous. They are more than the neurons, but they are there to support the neuron to perform their activities. Okay, so they support and protect them. They bind them together. Okay, so they perform very crucial role for the neuron to function. Without them, they can't also function. And like I said earlier, we have just 6 types. 4 are in the central nervous system and 2 in the peripheral nervous system. And this is what we have. The first one we call it oligodendrocyte or oligodendroclea. Oligodendrocyte, this one. Okay. Now, if we have a neuron like this, we say neuron have dendrites and axon. Okay, the axon end with axon terminal. They have terminal lines. Now, this axon is usually, if we have wires like the electrical cable, they are usually covered with rubber so that when you touch, it will not kick you. The same thing that God has also covered these axons or electrical wires that are in our body by oligodendrocytes. So oligodendrocytes are cells that malinate, and they malinate the neuron. They cover the neuron like this. Okay, so these are oligodendrocytes. Now, oligodendrocytes malinate neurons that are located in the central nervous system. And the central nervous system, we said earlier, is made out of the brain and the spinal cord. Oligodendrocytes malinate neurons that are in the central nervous system. And we say there. So when they malinate, now you see that there is a gap, not like the wire, that is no gap when they are covering and they cover everything. There are gaps between the myelin sheath. This is called myelin sheath now. This one. So this gap is called the knot of Ramsey. So you have the knot of Ramsey. So there are gaps between them. And they are very important in that during impulse transmission, impulse travel, they jump from one knot of Ramsey to another. So if this is 1, this is 2, they jump to 3, and jump to 4 in that. This is what we refer to like the impulses gallop. They move from one node to another. Therefore, speeding up the impulse transmission in neurons that are malinated. They speed up the signal transduction or conduction in neurons that are malinated. Okay, so these are oligodendrocytes. They also have the epidermal cells, which are also supporting cells. These, now, if we have the brain, within the brain, there are cavities there. And these cavities are called ventricles. And the ventricles are lined by epidermal cells. And the epidermal cells help with the capillaries there to produce cerebrospinal fluid. Okay? Then we have macroglia, and these are macrophages in the brain and then the spinal cord, which fight infection or the phagocyte foreign bodies that might enter into the brain. Then the last, in the central nervous system, we have the astrocytes. In astrocytes, these are abundant glia cells, and they perform several functions. So if you look at it here, we said they are the most abundant. They cover the entire brain surface, and then they form a supportive framework of the nervous tissue. Okay, but very important function is this one I'm going to circle. So please don't forget this one. Those who sleep, who are sleeping, please wake up and write this one down, because it will come in the exam. We say that they form what we call blood-brain barrier. So that if you take alcohol now, you're taking some alcoholic bitters into your blood, it will not yet cross to the brain instantly. There is a barrier that is created. Because if, imagine all the alcohol you're taking entered into the brain, then it will result in you behaving abnormal. So they protect the brain by preventing substances in the blood from just crossing into the brain. So that is astrocyte, very important function that you should write down. Very important. So if I ask you to list one function of the astrocyte, so you should write they form blood-brain barrier. Thank you. So these are just examples of what pictures of the astrocyte. Astrocyte, because they look star-shaped. We have macrophages, and these macroglia, they are macrophages that phagocyte foreign bodies or foreign molecules that enter the brain. Then these are epidermal cells, and they produce cerebrospinal fluid. And then these are oligodendrocytes. So these are the four supporting cells that are found in the brain. Then in the peripheral nervous system, we have just two, and these include Schwann cells. Schwann cells perform the same function like oligodendrocytes, but this time in the peripheral nervous system. So they also myelinate the axons, but in the peripheral nervous system, not in the central nervous system. So I can say that oligodendrocytes and Schwann cells are the same, just that oligodendrocytes are located in the central nervous system, and Schwann cells are found in the peripheral nervous system. Then we have a supply cell. These surround cell bodies in the peripheral nervous system. So if we have, this is the cell body, another cell body, okay. If we have group of cell bodies in the peripheral nervous system, we call it ganglion. So ganglion, it's here, this one. Ganglia, plural. Ganglia are a group of cell bodies, okay, in the peripheral nervous system. But group of cell bodies in the central nervous system is also referred to as a nucleus. Nucleus. So let me write it here. Nucleus. Okay. So this is nucleus in that. So nucleus or nuclei for plural. Nuclei are a group of cell bodies in the central nervous system. But a ganglion is a group of cell bodies in the peripheral nervous system. So they will all come in the exam. So you should write them down. Those are the answers. So if they ask you group of cell body, peripheral nervous system, then ganglia. Group of cell body in the central nervous system is Meninges. Okay, I hope you've written it down. So if you come back, the group of cell bodies in the peripheral nervous system are surrounded by satellite cells. So because of that, they are also called ganglionic gliocytes. Ganglionic, because the ganglia, ganglionic gliocytes. Okay, they are also referred to as that. Okay, so this is how those are looking like. Okay, so this a sample question. So let you 30 seconds to answer this. We said, which of the following cell types line the central canal of the spinal cord and the ventricular system of the brain? And they also produce cerebrospinal fluid. All right, so 30 seconds. Then you write down your answer. Let me see. Those in the YouTube, are you asking questions? I can't see anybody talking. So are you writing down the answers? I've seen 4 people commenting. Let me go to chat. Okay, somebody say E. E is epidermal. Anybody else? I'm waiting for the answers. Okay, Elsie is saying epidermal. Florence question. Okay, Gabriela. Everybody say E. David, Oda. Is it Huda or what? Or Uday? That is E2. Those in the YouTube, I know they see you. Okay. Okay. So Elizabeth Yato. Okay, somebody saying B. B is oligodendrocyte. Okay. I would do is E. I don't know what the person who said a B, oligodendrocyte. Can you explain more? What do you think is oligodendrocyte? All right, so the answer is actually E. I think everybody has gotten it right. Clap for yourself. You can let your children to clap in addition for you. And then now we come to this one too. This question 2. We say a bundle of isons. Very good. This one I didn't mention it. So anybody that can answer will get 5 marks. Bundle of isons in the peripheral nervous system is called a nerve, a ganglion, a nucleus, a tract, or commissar, and then column. Anybody, the first person that will get it right will get 5 marks. Where is the person? I'm waiting for the answer. First person that will get it right, you get 5 marks. Gloria, I think you should type. You want to talk? Okay, talk. Let me see. Somebody saying ganglion. B. B is ganglion. Ganglion. The first person that will get it right. Okay, fun. Okay, somebody say D. Let me see. D is what tracks. You say a bundle of isons in the central nervous system. Yeah, the person who put, let me see, D. In the peripheral nervous system, no, the person is wrong. Good, somebody had A. That is, where is the A person? Can we, can I call it Kenny Key? Very good. So the person who put A first is right. Kenikie, can you talk? That is the correct answer. A. Now, I didn't talk about that. Now, we say, so we only talk about it if we have group of cell bodies. We say that is called a nucleus in the central nervous system and then a ganglion in the peripheral nervous system. But if we also have bundle of axons in the peripheral nervous system, it is called nerve. So the first person who answered A is right, and that is Keniki or something like that. So when you can for 5 marks. Then the group or bundle of axons in the central nervous system is tracts. So this one is peripheral nervous system, and this one is central nervous system. Okay, so bundle of axons in the peripheral nervous system is called a nerve. So if we are working at the answer, what is a nerve? Then you tell the person that a nerve is bundle of axons in the peripheral nervous system. So the person doesn't understand, you ask him to go and Google. Then a tract is also bundle of axons in the central nervous system. Very good. So those who are answering right, you have a mark for that. So that is the first part. Any question? It's now 1:52. Any question? Any question?
Sir,
Yeah.
sir, please, you said adrenaline is an example of neurotransmitters. And I want to ask, yes, and I want to ask, we have an injection, that's the adrenaline one. And what I know is it ceases bleeding. And I want to know what goes on, where does it transmit the impulse to stop bleeding?
Okay, very good question. Now, what happened is that the adrenaline is a neurotransmitter and it's also a hormone. Okay. Now, what is the function of adrenaline? Adrenaline, one of the one you are talking about is a vasoconstrictor. If you understand what we mean by vasoconstrictor, that means it constricts blood vessels. So when you inject adrenaline, it constricts the blood vessel, and therefore it can stop the bleeding. But that's not the only function. When adrenaline is given IM or IV, what it does is going to speed up the heart rate. It increases the strength of the heart contraction and also increase the heart rate. Okay, so adrenaline can do other functions, but these are those. It also can cause bronchodilation, so that you can breathe more. It causes vasoconstriction, bronchodilation, and then it also increases heart rate, and then increases the strength. Okay, hydrotropic, that is the heart, how the heart contracts, and that. Are you fine?
Yes, please.
Okay. Thank God. So let me share another one. Okay, this one, stop sharing. This one. So that let's continue small and then see.
No.
Any other questions? If we have any other questions?
Say.
Yes.
Please, I didn't get the satellite cell.
Okay, the satellite cell, but do you get what a ganglion is? What is a ganglion? Or that one too, you didn't get?
Say.
Yeah.
It's a group of cell body in the peripheral nervous system.
Very good. So those group of cell body are surrounded by the satellite cell. So cells that surround the satellite cell, that surround the ganglion are the satellite cells. Do you understand?
Yes, please. Thank you.
Thank you very much for understanding. Somebody asking a question. Is there a question? Please, we also give dopamine when patients have low BP. Okay, Lisa. Okay, so dopamine acts on the brain. Okay, somebody else says, okay. Hey, who is there? Is it about the mark or what? Yato Elizabeth. Where the first person who answered the E? Let me check. Let me go back. E.
Yes, sir. Say it's me, sir.
Are you sure? Let me see.
Yes, sir.
Ah, yes. I didn't see that one.
Thank you.
Oh. Oh, okay. Yes, I can see it. So you are the E. I didn't see your own. I rather saw a Kenny something. Okay, Elizabeth, no problem. We've cancelled the other one. So you were the first. Yeah, so dopamine acts on the brain. You see that if patients have low dopamine level in the brain, it results in depression. Okay. It leads to depression. And if you have plenty dopamine in the body, in the brain, and that might also result in aggressive behavior like mania. Okay, so the manic patients and all that. So they may have those mania. So, but the relationship with the blood pressure that I may not be able to explain. I don't know whether I act centrally, okay, to reduce the blood pressure. That one I may not be able to explain to you. Okay. I think there are also other two people who say what. Please, when we getting this? You are not finished. Your has no slide. Go and read. Google and read. Say, please, can you repeat what again? The 6 types of neuroglia. Okay. So we're saying that we have the 6 types of neuroglia. There are 4 in the central nervous system. And these are the astrocyte. We have the oligodendrocyte, macroglia, and then we have the epidermal cells. And these are the 4 in the central nervous system. Then the peripheral nervous system, we just have 2. And these include the Schwann cells and also the satellite cells. So those are the 6 types of cells we have. Okay. 142 watching in the YouTube, and then we have 100 in the Zoom. So making about 242. Okay, not bad. But I think you are over 300. All right, so let's continue with the central. So we're now taking the central nervous system to look at the central nervous system. So the central nervous system is made out of the brain and the spinal cord, and the peripheral system is made out of the cranial nerve, the spinal nerves. We have 12 cranial nerves, and then we have 31 spinal nerves. So they form the peripheral nervous system. Then we say the nervous system is like the computer system, where you have the input devices like the keyboard, and then we have the mouse and all that. Those are the input devices. Then we have the central processing unit, which is the brain and the spinal cord. And this is the efferent fibers that send the impulses to the monitor. Monitor is an output device. And in nervous system, we call it the effectors. So these are input devices. and this one is called afferent, and this one is called central processing unit, and then this is efferent. Then it continues like that. Okay, so you see the input, you create this one, then the afferent processing, then you have the efferent, and this is the brain. Let me see. Wow, some people said, Lee, what are isons? We'll talk about it now. You ask again, what are isons? We say isons are processes, they are processed from the cell body that conduct impulses away from the cell body. So isons conduct impulses away from the cell body. So you just sleep and you wake up and ask the question, what is that? Stop sleeping. Okay, some of you are cooking and doing other things. I know you. Then, so these are, so let's see, the brain, the covering of the brain. The brain is covered by the scalp. See, the scalp is the skin, made out of the skin, the muscle, the connective tissue layers, and all that. So from the scalp, that's the outer part. So you are touching your head, you are touching the scalp, that is skin, and then the trachea under, we call it that is connective tissue. Then when you take out the scalp, the next is the scalp, that is the neurocranium, the one that contains the brain. You see your head, there is a bone there, so the bony part is the neurocranium. The visceral cranium, that is facial bone, we call it visceral cranium. But the bone that contains the brain is called the neurocranium. Okay. Then the meninges covers the brain. After that, you have the meninges. And then even after the meninges, you have what we call the cerebrospinal fluid. That also covers the brain because the brain is soft, like things that are soft. Okay. If you know things that are soft, the brain is like that. It's very soft. So people are laughing because you'll be sleeping and then wake up and ask any questions. Don't be doing that. So the brain is very soft, and so it's covered, it's protected by the scalp. Okay, so the scalp, and then I'm coming. I didn't use my pointer. So this is the scalp. Then you have the neurocranium, that is the second one, and then the meninges. We have three types of meninges or three layers of the meninges, and then cerebrospinal fluid. Cerebrospinal fluid, that is there. So this is how it is. The no, there's no. So this is the scalp that has been. So you can see the scalp there. Okay. Then after that, this is the bone layer showing. They will have the meninges. Okay. Okay. Then this. So when you take a this also the scalp, the neurocranium, and then this one. So this is, so let's go. The brain covering comprises, the brain coverings are three. So after, the meninges, okay, the meninges are three. After you have the skull, okay, so let me write skull. You have the skull or the cranium, okay, skull. Then you have meninges, like this. And the meninges are made of three. This is very important clinically because we have infection of these meninges. So the first one, we'll call it the dura. So we have dura mater. Okay. Then we have the arachnoid. So arachnoid. Okay. Then we have pia mater, like this. Okay.
Mr. Jabrela Mukaila, you are not the host.
Okay.
Hello, Jay. 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 Jay.
Jay, the bed. So now that the Zoom is full, Wednesday is coming back. How is he coming back?
Yes, that's why I wanted to find out from Jay if he can prompt him. For all you know, he's still online because of the how do you call Zoom, YouTube aspect. So he might not know that he's off this platform.
No, even the YouTube is off. The YouTube is an extension from the Zoom.
This one, unless one of us exits. Unless one of us exits.
Sairi.
Please do that for us. Do that sacrifice.
Right.
No, the rep should sacrifice.
He's back. He's back.
Okay, say it's back. Say it's back, please. Jay the bed. So now that the Zoom is full, but he says he's coming back. How is he coming back?
Yes, that's why I wanted to find out from Jay if he can prompt him.
No, I mean,
online because of the Zoom, YouTube
aspect, so he might not know that it's off this platform. The YouTube is off. The YouTube is an extension from the Zoom.
It's not off.
We can go on. Is the YouTube.
Hello. I'm in.
Then you are welcome back.
Okay. So yes. So this is the brain. If you break your head, this is where you are going to find. This is where you can go and practice that. If you cut off your skull, you remove this way, then you see your brain like this. I don't know where you can see. So you see there is an artery moving this way. We call this one middle meningeal artery, moving up like that. So this is a middle meningeal artery, and this is supplying to the meninges. Okay, supplying to the meninges. So now, what we've cut out, this one is the dura mater. Okay, that's the tough matter, not the dura mater. Then we are now seeing the arachnoid covering the veins. You can see the veins. They are draining the blood from here all the way, and they drain it inside here. We call this one superior sagittal sinus. This is called superior sagittal sinus. That's where the deoxygenated blood from the brain is being drained in. Then from superior sagittal sinus, they drain out. Okay, the long process. Yes, so here you have it. So this is the superior sagittal sinus. You know, during infants, like newborn, you see that the anterior fontanelle, you see pulsation there. So it's from this superior sagittal sinus. Okay, then so deoxygenated blood drain this way. Then here we call it confluence of sinuses. And then the blood may drain through the left side or the right side. This one is called, okay, I already mentioned all this. Okay, so this one is called the inferior sagittal sinus, and this is called the straight sinus. Those are the venous drainage systems. They are called sinuses in the brain. Okay. This, okay. Yep. So this is the floor of the skull where the brain will be sitting on. Okay. So we are just seeing briefly. Dura space. Now the dura, we have what we call epidural space or extradural space. It is a space between the skull and the dura mater. Let me go back to this one here like this. But you can see this is the dura mater, and then this is the skull. So this space between them, it's what we call the extradural space. Now, sometimes this blood vessel may be broken or may be injured. And there's an area around here that we call the pteriole, that's the weakest part of the brain, the skull. So if you want to kill somebody, you hit that side, okay? When you hit there, it will break this blood vessel, and then the person will be having epidural hemorrhage. They have to be bleeding like that. It compresses on the brain, and the person dies, and you are happy that the person dies in that. Thank you. So that's the now. So that means that the space between the dura and the arachnoid is also called subdural space. Okay, and there you may also have what we call subdural hematoma or bleeding. That is when these blood vessels are broken, then it will also result in venous bleeding under the dural space. Okay, that one is called subdural hemorrhage. So this is what we are saying. So extradural, say fracture of the site of the skull rupture the middle meningeal artery. That's the one I was showing you. And this causes extradural hemorrhage. And then the subdural space, the one I was showing you, can also, the blood vessel, the veins that are draining into the superior sagittal sinus may also be ruptured. And then you have bleeding there. The arachnoid matter, that is the middle layer, is like spider web. That's why it's called arachnoid, because the spider belong to that grouping. Okay, so arachnoid matter. And the space between the arachnoid matter and the pia matter is called subarachnoid space. And that is where we have cerebrospinal fluid circulating in the subarachnoid space. In certain, okay, this one is not. All right. So another question for 5 marks. I'm writing down. Elizabeth got the first one. So if we are able to get this one, the first person that will answer this will get 5 marks too. Identify the correct order of the meninges in the skull from superficial to deep. So the time starts now. Write it down. Write. Don't talk. Write. So if you write it and you are the first, you will get a mark. Let me check the answers. Somebody say D. Hey, let me see the first person. We have D is dura mater, pia mater. So D, somebody says D, dura arrangement. So let me see the first person that had it correct. The answer is, I write it. The answer is dura mater, arachnoid matter, and pia matter. So the first person is Patricia Deborah had it C. Good. So that is the first person that got it correct. The rest are answering, but you are late. So the answer is C. Good. So Patricia and Elizabeth, you have 5 marks yourself. Okay. But those in the YouTube, they will not be able to. But they are supposed to also answer. I don't know why they are not commenting. They are just sleeping. YouTube people are sleeping or they are listening. All right, so let's continue. If we get another question, they will answer. Now, where are the cerebrospinal fluid produced from? They are produced from cavities in the brain, and these cavities in the brain are called ventricles. And the cavities are lined by a type of cell called, can anybody, if you get it first, if you get it right, this one right, you get 5 marks too. That is, the cavities in the brain are lined by which type of the neuroglia? The neuroglia line, some of the neuroglia line the cavities in the brain. And these are called, so if you are the first to get it right, you also own, you also get that. Somebody to argue, you say, well, Agatha had done what? Is it the name of the? Yes. What is the answer? Which cells line the cavities in the brain? Is it Agatha? Somebody say Agatha. Okay, Jay said epidermal cell. Anybody else? So very good. So that's epidermal cell. So Jay, you also have 5 marks with me. Then, so these are the cavities we are talking of. And these cavities are lined by epidermal cells. And the cells, together with the capillaries, form what we call choroid plexus. Let me spell it. Let me write it. So we have what we call choroid. Choroid plexus. These produce the cerebrospinal fluid. Like, and the choroid plexus are made up of what? The epidermal cell with the capillaries in these cavities. So if you are asked to write the cell, the structures that produce cerebrospinal fluid, so this is what you are supposed to write: choroid plexus. Okay, choroid plexus. So it also comes in the other. Okay, so these are the capillaries. Now the ventricles are 4 in number. We have 2 lateral ventricles. So this is 1, this 1, this 2, this 3, then the 4th one is around here. So 2 lateral ventricle, okay, and then this is the 3rd ventricle, and then we'll have the 4th ventricle. Sorry, I've increased it big. Okay, all right. So yeah, so it's still the same thing there. Now, the cerebrospinal fluids are produced from the lateral ventricle. About 80% of the fluids are produced from the lateral ventricle. And here you can see these brown things, that's the choroid plexus, and they produce the cerebrospinal fluid. Okay, the choroid plexus. Then from there, they are moved into the 3rd ventricle. So this is the 3rd ventricle. Through this foramen is called the interventricular foramen. So this is the 3rd ventricle. And then from the 3rd ventricle, they pass through this narrow structure here, a channel that we call the cerebral aqueduct. This one. So this is the cerebral aqueduct. Okay. So the cerebral aqueduct. And then from there, they come to the 4th ventricle. And the 4th ventricle, they also produce some. Look at the choroid plexus there. These are the choroid plexus. Then they now move out into the subarachnoid space. Remember, the subarachnoid is the space below the arachnoid matter. So they now move out into the subarachnoid space like this. Okay, and they surround the whole brain as well as the spinal cord. Okay, they make the brain buoyant. Okay, the buoyant like the cerebrospinal fluid. They make it so that it can, it's lighter. You know, if you have a very fat woman and you want to lift her, you put her in water, she become lighter. Then you can lift her in water. Okay, so that is what can happen. If you want to lift your wife who is very fat, or your husband that is very obolo. Okay, so that is, it makes the brain lighter, and it serves as a cushion, so that if you even hit your head, it will the brain will not go and hit the other side of the wall of the skull, and there it, because we say it's very soft, like things that are soft. The brain is soft, so when it's like when something touches it, then it will get destroyed. So if you are in water, it serves as a cushion to it. So that's the function of the cerebrospinal fluid, serving as cushion. They serve as it's a protective cover too, because it serves as some of the protection covering of the brain. It makes the brain also lighter because buoyancy make it lighter. And then they also cleanse the brain, nutrients is there. It gets like plasma and all that. So give it some nutrients, take out dead material and all that from the brain, or waste material from the brain. So that is what happened there. We will not now from after the cerebrospinal fluid circulate around the whole brain, it's been absorbed into the superior sagittal sinus that we've learned. These are veiny blood by what we call arrhythmia.
Sir.
Yes.
Please, I have a question.
I'm going to answer question. I'm listening.
Okay, the fluid, the cerebrospinal fluid, you said it takes out dead materials. And I want to know because we also learned that it is a sterile fluid. So I want to know how dead materials can be in a sterile fluid.
Okay. Yes. So well, if you say something is sterile, it doesn't mean that when we have the waste product I'm talking of, it will not make it contaminated. It will not make it contaminated. It's inside there. So let's say some waste product, like in the body, let's say the urine and all that they carry out, they remove things like the ammonia, some of those gases and all that. That might be this, and this is going to the venous blood. So those waste products will carry into the venous blood that will send for other purification in the kidney and all that. So that doesn't mean that it's not contaminated in a way by bacteria or other microorganisms. That is not what I'm talking about. Okay. So let's continue with that. So these are the functions we are talking of. So as we said, the cushion regulate intra and intercellular contents of the central nervous system. Example, if blood or brain volume increases, nourishes nervous system, removal of products. You see, that is what I'm saying here. Removal of products of neuronal metabolism. See, so they take up that one. They also serve as medium of circulating and transporting substances, such as hormones. Okay, they serve as cushion, make it buoyant, make the brain buoyant, and that. Now there are times we have overproduction. Let me go back to this diagram. I said every day about, let's say, 800 to 1,500 ml of cerebrospinal fluid is produced by the correct places. Now, they have to imagine they are being produced and not taken out. That is why they have to be absorbed by what? Arachnoid villus or villi, plural. So arachnoid villi reabsorb the cerebrospinal fluid into the blood. So if there is failure for this arachnoid villi to absorb it, that means there will be accumulation of fluids in the brain, and we refer to it as hydrocephalus. We have two types of hydrocephalus. It could be what we call communicating hydrocephalus and non-communicating hydrocephalus. Now, in non-communicating, you see this place. The fluid is produced in the cerebrospinal fluid, and maybe is not able to drain out into the subarachnoid space so that it can be absorbed. And therefore, the fluid is produced in the ventricles here and cannot come out. So we call it the non-communicating or internal hydrocephalus. But sometimes when it is able to come out through the median aperture, and we have the lateral aperture, they come into the cerebral subarachnoid space, but cannot be absorbed, then we call it communicating hydrocephalus. So those are the two types. And hydrocephalus excess excess accumulation of cerebrospinal fluid. And then the person, if it is happening in the childhood, then the child will have a very big head, like a head monster. Okay, so that is why we have this. I think there are questions around. Let me see what they are asking. Somebody just laughing. Somebody is what again? These are all the questions. Okay, I think the questions are just can it be a shock absorber? Yeah, so the cushion, yeah, they were shock absorber, that's it. So and then don't know. Okay, so that's all the LC join.
Sir.
Okay. Yes.
Please, for the hydrocephalus, what can be done to save the child? In case
for management. Thank you. That's a very good question. Now, in Ghana, yes, so there's something can be done. So sometimes they pass a tube. Let me go back to that diagram. This one. Okay, so you see that if it's due to failure of the arachnoid villi to reabsorb the fluid, okay, so they can pass the tube that comes here, so that inside the subarachnoid space, and then they will put it under the skin, then it will get to the peritoneal cavity. They will, from the neck side, then the thing will lie in the neck, and then they put it inside the peritoneum, so that the fluid will be draining through the tube into the peritoneum, like the abdominal cavity, the peritoneum, so that the peritoneum can reabsorb the fluid. I've never seen something like that time, but I'm not especially in that area, so I can't tell. And then they can also be venues, like they can connect veins or artery into the this particular area, that is the subarachnoid space, so that the fluid can be drained straight into the veins. They can connect it like that. But you need a vascular surgeon, we need a brain surgeon, you need like a lot of specialty to do that. That is when it is communicating. But when it is due to blockage of the cerebral aqueduct here, that means they have to pass something into this part that will open it up. Okay, that's a serious surgery than the first one. Okay, so you have passed the tube, and that will open here. Okay, so that the fluid can now come out and then go to reabsorb. So those are the surgical procedures that can be done. Yeah, the ladder. Wayi, or yeah, your hand is up. Stop. There are them talking. Let's go on. If you are not talking, we are going. Good. Another question. It says, so hydrocephalus is a condition that results in dilation of all or part of the ventricular system. I believe now we know what the ventricles are, ventricular system, due to obstruction of the cerebrospinal fluid flow. There are two types, non-communicating or obstructive hydrocephalus, and they block in the ventricular system, obstructing cerebrospinal fluid from communicating with the subarachnoid space. And they will have the communicating or non-obstructive hydrocephalus, and they block in the subarachnoid space or the arachnoid granulations. Very good. So those are the
I was disconnected. Sorry. We are commenting on YouTube, but it's like you're not checking it.
And I'm not seeing it.
It's a whole lot. You should check the chat room.
So hydrocephalus is a I'm coming, let me see. Well, I'm not seeing where the thing is. I'm coming. Okay, yes, I'm not seeing your messages. I'm sorry for those.
Yes, so we lost the 5 marks.
Oh, I'm not seeing them. And how do you come here? I'm not seeing them, the E and those ones. Oh, okay. I have to come and mark only your title. Wow. I've seen a lot. I'm coming. Okay. So say this. Okay, so let me see. Somebody asked me a question at the YouTube. Say, is it been drained? What happened to the size of the head? Okay. So says after it's been drained. Okay, what happened to the size of the head? Okay, so I'm thinking he's talking about the hydrocephalus, the treatment. Oh, like where the head that is making the fluid that is making the head to be big. So when they drain, it will come to normal, and then the person will grow normal. So it's not any this. So somebody said what you can see what I think the concentration is. Oh, sorry. This place the concentration is on the distance. I was not actually seeing it. Sorry. So I'll be monitoring it, okay? So now I'll just be concentrating on you people. Plenty. I'll not mind the Zoom people again. Okay, okay, yeah. All right, so now any question? Identify not question, we are answering this one. But say identify. Yeah, Edward, your hand was up. When I say so, you won't talk.
Yeah, so please, you said for the hydrocephalus, after draining the cerebrospinal fluid, the head will come back to normal.
Yeah.
Okay, but I quite remember I asked one neurosurgeon at Kolebu some time ago, but the response was like where the head has grown to reach, after draining, it won't come back to normal, but it will remain there, and the head will not grow again too.
And it will not grow again too.
Yes. He said like the size of the head where it has grown to reach, it will stay there, it will not come back to normal. It will stay at where it has reached, and it will not grow again too.
No, okay. So yeah, I get what you are saying, but it depends on the age. I don't know if it happened, and maybe the drainage is done early, like the surgery. I don't know what age so that means have you witnessed one being done the time you ask the question?
Yes, please.
So okay. And how was that one done? Because what I described or what I saw, that one was that Kupanoche, that it was done that way. But I don't know the one you saw. How was it done? Well, how was it?
It's like I can't remember, but it was done at an early stage of the baby. So during that time, the head hasn't grown much. So after doing it didn't get back to normal, but it didn't grow again. It stayed there.
Okay. Well, we can also find out and see. We can find out more. Okay, but it's a good thing. So it will make me to also find out how that one is, because I'm looking at, let's say, like the one you are saying, if it is, let's say, 3 years and the head is still small by then. So are you saying that it will remain like that if the person is even adult? I would say that. That is why I'm looking at.
Please.
But let's find out. So we can't say what the person said is wrong or whatever. So we'll find out later, okay? But we can also go. Yeah. So let's answer this question. Okay. Okay, so somebody asking whether those are the YouTube. He said, "Great, is hydrocephalus a fatal anomaly?" Okay, so sorry, and the YouTube. Somebody asked the question that okay, they are answering it. That is the hydrocephalus a fatal anomaly? You see, if they don't treat it, and the fluid is continuously adding, then it's going to result in what? It's going to result in the head, like because the brain is soft and the water is compressing on it, then the brain will finally get destroyed and then the person will die. Yes, so it will be fatal in that. Now, so people have started answering the question. They said, identify the figure where the following occur and if they are considered communicating or non-communicating hydrocephalus. Okay, so if we take one subarachnoid hemorrhage, so if it's bleeding into the subarachnoid space, will it result in communicating or non-communicating hydrocephalus? Then cerebral aqueduct stenosis, and then obstruction of the foramina of Lotka, that is Dandy Walker. And then suppurative meningitis, cholestasis of foramens of Moreau, and choroid plexus papillomas. So it's just trying to see the causes of communicating and non-communicating hydrocephalus. So you see things like cerebral aqueduct stenosis. That means stenosis here will result in non-communicating hydrocephalus. That is what it means. So, but some people have answered in the YouTube. We have cancer, fetal anomaly, or the person is talking about fetal anomaly. Okay, yes, so it's fetal anomaly. It's a congenital anomaly. That can, okay, yes. Okay, I didn't know that's what you were asking, but you didn't type the word. Okay. Somebody say yes, so please cancel the 5 marks. So people are wicked though. So cancel the 5 marks you awarded to the Zoom people. Hey, oh, some people. You don't want your brother to chop. Okay, so let's continue. This one you can't really answer it like what. So these are communicating and non-communicating. Using the colors, you can see that some people. So don't worry about this. Let's look at the brain a bit. Hey, so it's 2:48. We'll close at 3 o'clock. Okay, so that I have another lecture at 3 o'clock. So we'll close at 3 o'clock. Okay. Now let's look at the brain. The brain is very soft and covered by these meninges, the scalp, and all that. The brain is made up of 3 parts. I'm going to remember we said central nervous system is divided into the spinal cord and then the brain. Okay. Now the brain is also made up of is made up of 3 parts, 3 main parts. I'm going to draw that. The brain. So let's take note of that. The brain you are having. The biggest part is called cerebrum. So you have cerebrum. Okay. And then you have cerebellum. Cerebellum means small brain or little brain. So cerebellum. And then we have what we call brain stem. Let me abbreviate it, brain stem. So that is the 3 components of the brain. Then this one, the brain stem, is also made up of 3 parts. Okay, that is what we call midbrain. So midbrain. Then we have pons. We have the pons, and then we have medulla oblongata. See that? So it's made up of that. So if you are able to organize it in your mind, that the brain is made up of 3 parts: cerebrum, which is the largest, the cerebellum, little brain, and then the brain stem, which is the livestock. That is, the cerebrum is made up of cerebral hemispheres. You might have
It's gone again.
Bye.
Mukaila.
Yes, I'm here.
You can remove anybody and then allow him to come in. The time is almost up, so let's rest. I don't go. I suggest they remove you so that you can come in and compete for us. You are suggesting. Thank God you are
I support
suggesting.
you. I don't go. I support you. Let's rest.
This hot afternoon with your brain. Eh?
Hello, please highlight on the communicating and non-communicating hydrocephalus wires. Hello, Mr. Adongo, are you around?
Hello. Hello.
Hello, let's wait. Say we'll be with us soon.
Hello.
Kaila, you remove me. You have to do that.
Good morning, class. Good afternoon.
Good afternoon.
Bro, good afternoon.
Hello,
Yeah, please, Doc said he is now meeting the medical students. So we'll meet tomorrow morning, 7 to 10.
All right.